Hi, my name is Megan Tarvis, and my flashcard this week is on renal calculi. They are known as kidney stones. So we're going to talk about the different process and pathophysiology, signs and symptoms, and diagnostic testing. I work in a women's health ED, so I see kidney stones all the time in my practice for pregnant patients and non-pregnant. I'm sure all of you have seen kidney stones as well with your patients. So they're very common. It can be an acute event or it can be chronic. Acute, where that person develops a kidney stone during pregnancy and they may never have one ever again. Or they can be chronic and prone to them due to diet, hydration, anatomy of the kidneys, or other comorbidities. They can range in size. Small usually is asymptomatic. Some people may have kidney stones and not realize it until they go for imaging or something else. But they become symptomatic when they're large. For example, a staghorn is one of the larger kidney stones. It's named after its shape due to deer antlers. It looks like antlers on a deer. So that can, as you know, can be very obstructing. If you think about that in your kidneys, it's not traveling down and passing. It can obstruct urine flow and lead to worse infection. So supersaturation occurs in the kidneys. This can be because the urine is becoming, again, supersaturated because solutes exceed their solubility. They become non-soluble. And then they form crystals. They go through 4 phases. Those 4 phases are nucleation, growth of crystals, aggregation, and retention. There's several components that work for stones to form. We have the relationship between the inhibitors, and if that inhibitors are overwhelmed with the production of certain solutes, for example, oxalate, they're not going to be able to inhibit and crystals are going to be able to form. If urine volume is lower, they're at risk for that super concentration again, and solutes are at risk for crystallization. The level of the pH also affects stone formation. For example, a higher pH creates an alkaline state, which can cause calcium phosphate to form, and they are less soluble. And I have also read that an acidotic state can also create stones, different types of stones as well. So kidney stones are common, like I mentioned. They actually occur, I've read in several studies, 1 in 11 individuals, 1 in 10 individuals. They occur in both men and women. Evidence found that men are more at risk for developing stones. If you have a medical history of obesity, diabetes, you're more at risk. Your anatomy of your kidneys, if they're any type of anatomy that can cause stones become obstructed. And then, of course, if you are have a history of kidney stones, you're more prone and you're at risk for developing more. Another risk factor is actually interesting due to geography. I read a study in Saudi Arabia due to the heat. Again, because heat causes dehydration. Dehydration can lead to formation of kidney stones. Individuals that have kidney stones in the bladder or kidneys, they usually don't have any symptoms unless the stone is obstructed, infected, and can cause distension in that renal capsule. Usually, individuals will complain of low back pain, known as flank pain, urinary symptoms, hematuria. They're going to be restlessness. They're going to be in a lot of pain, nausea, vomiting from that pain. And that pain location can also change, but it's usually at the site of obstruction. And if it starts to travel, the pain will follow. The location of the pain will follow the obstruction traveling. If they're small enough to pass and they're not obstructed, patients will feel relief right away once they're passed. We, in the ED, if we have a kidney stone, patients will either bring in their kidney stones in like a napkin, and it's like these tiny little gravel crystal like structures, or we provide them with a strainer and they urinate and they can visualize that the kidney stone has passed. And then we're going to talk about diagnostic testing. Diagnostic testing, we need to establish if there is a kidney stone present so we can treat. So the first thing we're going to obtain is urinalysis because they're complaining of lower back pain. So it could be just a UTI, like UTI symptoms, but we want to look at that high. If they have a high urine specific gravity, that's an indication of dehydration. And that means fluid intake is limited. Again, dehydration can cause crystals to form. We can also establish the pH to establish what kind of stone is present, if it's acidic or alkalotic pH in the urine. And crystallization also may be present in the urinalysis as well. There are several different types of diagnostic tests. The most accurate diagnosis for a kidney stone would be a non-contrast CT that detects all types of kidney stones, the location. However, there's contraindications because there are risks for radiation and they are more expensive. So hospitals are seeing a lot of patients risk for kidney stones. So they're getting these tests, high cost tests done for both the patient and the hospital. So ultrasound is kind of like the key diagnostic test usually used, especially in the pediatric and OB population. So my ED, we usually send patients down for an ultrasound, less exposure to radiation. However, it can be non-specific at times. And there is also another kidney urinary bladder imaging known as KUB imaging. That's basically an X-ray that detects renal stones. A urologist and a radiologist will look at the imaging when they are developed. And they are often used in ED because they're affordable and they're effective. They're quicker versus a CT, and it puts them at lower risk for radiation. And that is my presentation. Thank you for watching and have a good week.